What we talking about before you go?
Hey y'all, what's up? It's Dr. Mia and Joseph with Ageless Intimacy with Dr. Mia and Joseph. And today we'll be talking about infertility and intimacy. We had a nice segment with comedian Joy on yesterday where we talked about infertility and total wellness. And today we'll talk a little the same, but kind of from a relationship standpoint as well. So we're going to let everybody get in the room so we can get this conversation started. Again, I'm Dr. Mia, your B3 specialist and board certified gynecologist at Mibella Wellness Center, where we offer gynecology to women and adolescents, as well as total wellness solutions for both men and women suffering with weight gain, fatigue, and sexual dissatisfaction. We offer hormone pellet therapy, weight management, intimacy solutions, total wellness solutions with supplements, and laser hair removal. Our goal is to help you live well, age well, and experience everlasting intimacy. And this is the luckiest man in the world. Joseph, you want to introduce yourself?
Yes, I'm Joseph Brown, Mibella Men's Health and Intimacy Coach. How you guys doing today? Today, again, we're talking about intimacy, fertility, and total wellness.
Yes.
Okay, good. So, Dr. Mia, let's talk about fertility or infertility, right?
Infertility. Okay.
Infertility. Let's talk about what fertility.
Yeah, let's talk about fertility.
Let's talk about fertility.
We'll hit on some of the concerns and issues
when it comes to infertility. Okay, good. So with fertility, when it comes to women, what are some of the things that you look for? Or let's say a woman comes to you and say, "Hey, I'm up in age," and we don't know what up in age is, so we're not going to describe that. But I'm up in age, and I want to know if I am fertile.
Right.
Okay.
So then the first thing I would do is get a history, of course, and get some, information. So with the history, I want to know, are your cycles regular? Are they coming every single month? I want to know, especially if it's somebody in their 40s, are you starting to have symptoms of perimenopause?
And what is perimenopause? We talked about it last week or a couple of weeks ago, but just real quick, what is perimenopause?
When your testosterone levels start to decline, which is the real first hormonal change where you become symptomatic. So it's lower testosterone, and that's when you start having night sweats and problems with sleep. And of course, you need libido in order to get pregnant because you need to have unprotected intercourse, right?
You need to have drive.
A change in your enjoyment of intercourse, fatigue, joint pain, belly fat, weight gain, mood changes, and mind fog.
Okay,
so I want to know, are you having any of those symptoms? And of course, we're going to get some blood work. And when we get the blood work, we get the hormone panel, which lets me know that your thyroid levels are normal. I would still go ahead and get a prolactin if your cycles aren't as regular, because that kind of tells me, if it's because of high prolactin, which is another conversation that can cause irregular cycles.
Okay.
I would also want an AMH, which is anti-Müllerian hormone. So that's actually a blood lab that we can draw that lets us know how many good eggs you may have, and we like for that number to be over 1. When I have somebody with PCOS, it tends to be really high, like really high, like 7, 8, 9, 10. But when I have a normal person, so it gives me information about PCOS, which lets me know your insulin resistance, because that's one way we can help with fertility. And then it also lets us know, what are your eggs looking like? If it's over 1, we're like, oh, okay, well, we should be good. And if it's under 1, we're like, okay, so we're getting to that point. We don't have as many viable eggs. So this is more of a rush thing, not rush, but we want to not take a lot of time. So a lot of times if it's somebody in their 40s, I would recommend that they go ahead, if their egg count is low, to just go ahead and see a reproductive endocrinology and infertility specialist. Versus if it's somebody in their 30s or 20s and they just aren't getting pregnant, I would, work with them more, because it's more affordable to do the basic workup of fertility.
So let me ask you this, Dr. Mia. Let's say about somebody's 32 years old, not married, don't plan on, they're a career person and they don't plan on being married, but they don't plan on being married soon, but they do want to get married and have kids, probably closer to let's say a perimenopause stage, but 38, 39
40,
years old, 40 years old, what would be your suggestion to that person?
So I would do those same things. I check the labs and everything, and then I would recommend that they get their eggs frozen. So women can have their eggs frozen. I always joke and say it, but I'm really serious. Like, that's one of the gifts that I want to give my child at 25 is, let's just get your eggs frozen. So that way, because she probably would not have a career that she would get married early.
Right.
And I want her to have those options later. So then if we go ahead and freeze her eggs while she's really young, she'll have lots of eggs and she will have the option to get pregnant later in life because she already has eggs frozen. So I do recommend that to a lot of my patients, and I'm glad you brought that up. Okay. It is okay to get your eggs frozen. Even if you're a couple and both of y'all are working on your career, you don't really want to rush and have kids, that's something you may want to do in the future. It's never wrong to go ahead and freeze your eggs so that you have that opportunity later in life and be able to use your own genetic information.
All right. So again, if you just tune in, we're talking about intimacy, fertility, and
total wellness,
and fertility, infertility, and total wellness. Right. So again, we just went over some of the things that Doc would suggest if a perimenopause person came in, and if a younger person came in and he said, "Hey, I got a career. I'm not getting married till I'm probably past 35, probably won't have kids. I'm close to 40. What should I do?" And she said, freeze, she would suggest freezing eggs. So now we're getting to fertility, infertility. And what would be some of the things you address when it comes to infertility?
So it's 3 causes of infertility. Well, I guess it's 4 because sometimes we just don't ever know what the cause is.
Right.
But the things that we look at is, first, you have to ovulate in order to get pregnant.
Okay.
So we know you're ovulating more than likely if you have regular, predictable cycles that come on every month. We know
regular, predictable cycles. That's very key. I'm going to come back to that. So go ahead.
And then so ovulation, you need to be ovulating. Then men have to have good sperm. So we check that.
That was the 4th one I was going to add into it, but go ahead.
That's the 2nd one. So the ovulation, the male sperm, and then the female factor is the tubes. So if you have making sure that your tubes are working. Okay. So ovulation, we check with some blood work, some history. And you can do ovulation prediction kits so that you know that you're ovulating during that time. The time that the average woman ovulates, we say is day 14. But what I tell my patients is, if you are trying to get pregnant, you should be having unprotected intercourse at least every other day, days 10 through 17, when you count the first day of the cycle as the first sight of blood. It's not the first day of heavy bleeding. It's the first sight of blood. That is day 1 of your cycle.
Not the last day,
not
but
the first day of bleeding.
Okay.
And it's not, if you start spotting, you still count that as your first day of your cycle.
So for the dumb person like me, days 10 through 17 is not like November 10th. It's day 10 from that first sight of blood.
With day 1 being the first sight of blood, that's day 1 of your cycle. 2, 3, 4. So then you count from between days 10 and 17, and those days you should be having unprotected intercourse at least every other day.
Got it.
And that's what I say. So if you're not ovulating exactly like the average woman, we should still hit it. And we know the sperm really lasts in 2 to 3 days. So we say if you do have intercourse at least every other day, you should definitely hit your ovulation day.
Good deal.
So the way we check for ovulation is the history and the blood work. The way we check for the male factor is we have him to give a sperm specimen.
So we get a sperm count.
Yep. And we get this and motility and all of those things and make sure it looks normal. And then to check the tubes, and to check the tubes, we do what we call an HSG or a hysterosalpingogram, which we do in radiology. And what we actually do is we shoot dye through the tubes, and we take a picture so we can see that both tubes spill the dye. As long as at least one does, we know that your tubes are working well.
Good.
So then what I have noticed, though, go ahead.
No, we had 3.
That was the 3. Ovulation, tubal factor, male factor. And then not knowing. That was the fourth one I said.
Okay.
Sometimes you just can't come up with a reason. The tubes are open.
Yeah.
The husband has great sperm or partner has great sperm.
Mhm.
And then we know you're ovulating because you tested, but it just doesn't happen.
Okay.
And so that's when, we start to do our workup. We can add some ovulation induction medications. But the thing about women getting pregnant later is you still got to have a libido. So what I have noticed is that with some of my patients, they're coming in, they may be on their second marriage, or they may have just decided that they want to have another kid.
Mhm.
And what they notice is that they're having all the perimenopausal symptoms, but so they end up getting on testosterone. And what I do notice is that when ladies get on testosterone, they do tend to get pregnant
They have
faster.
babies. Right.
They have babies. So I don't know if that's because they have more intercourse or if that's because it does something with the hormones. Because if you think about it, when women are most fertile is when they have the most testosterone in their earlier years of life.
Mhm.
So I don't know if it's an actual, testosterone component to it. But what I do know is I've had quite a few, at least 5 to 6 women who were mature, meaning well over 35 and 40, get on the pellets. They may have been thinking they were going to get pregnant or trying to get pregnant, but it wasn't happening. So they were like, well, let me just start feeling better. And then they end up pregnant. So I know that it doesn't hurt. We know that testosterone does not cross the placenta, so it won't harm the baby. We just don't continue testosterone once you're pregnant.
Absolutely.
Right. And I do have some women who do creams, so it's very easy for them to stop the creams once they're pregnant. But now remember, if you're trying to get pregnant and your male partner is getting testosterone, that is birth control for men. Do not try to get pregnant when your partner is on testosterone. So everybody has to be clear and honest. You cannot take testosterone and still get your partner pregnant.
So that's communication, because sometimes, not everybody's coming to Me Bella Wellness to get testosterone, especially men. Some of us are getting shots, and not a lot of us are getting pellets, which we're going to be talking about this week, by the way, man. But anyway, not a lot of us are getting pellets. So that goes back to having open communication regarding what your plan is to get pregnant.
And with your doctor.
And also knowing that, if your doctor haven't told men, if your doctor hasn't told you, hey, FYI, if you're trying to get pregnant, or you and your wife, y'all trying to get pregnant, we probably need to get off the testosterone.
Right. We do need to get off
That's
the
an open communication. So that's communication between you all, between the couple, and a communication between you and your physician.
Right. And physicians have to communicate with their female patients when they're trying to get pregnant and confirm that their partners are not on testosterone, which could hinder pregnancy.
Right. Because we could be just working for nothing.
Right.
So
and not getting the blood work as well, because I've had women who were working for nothing and nobody ever checked their blood work to see that they went through what we call a premature ovarian failure. And so they went into early menopause. So they had been trying all of these things and nobody had simply checked their FSH to see that they were in menopause. So they spent all this money and time trying and paying for it, and it wasn't going to happen that way because they were in menopause.
Right. So. Is there anything they can do if they do go into ovarian failure?
There's not a lot that can be done. They can see an REI specialist and see if it's some eggs to be retrieved, but more than likely they're going to have to get donor eggs and IVF. All
right. Well, good. So we're talking about intimacy, infertility, and total wellness. So we're going right into the total wellness because we've been talking about testosterone. So, what are some of the things, since we're talking about infertility, what are some of the things we should be doing early in life to kind of, we can't control everything,
right? But
what are some things we can do to help
control
not have infertility, I guess?
Right. That's a great question, Justin. Look at you. So one, protect the tube. So making sure you're having safe intercourse and you're not getting exposed to a lot of sexually transmitted infections, because that can affect the tubes and cause tubal factor, which keeps you from getting pregnant.
Right.
2 is living a healthy lifestyle. So maintaining a healthy weight, decreasing your risk for chronic disease like diabetes, high blood pressure, heart disease, cancer. So maintaining a healthy weight, eating a healthy diet, exercising regularly. And if you do have any chronic disease, controlling it very well, because if you're going to get pregnant later in life, you definitely want to be healthy to decrease risk for you and the baby.
All right. So you said maintaining a healthy weight. So what's the BMI of a healthy weight?
Less than 25 for a woman.
Less than 25 for a woman. And for a man,
it's technically less than 25, but I say it should be less, around 27, 28.
Okay. Let me just.
It doesn't change for race. No.
That was my next
No,
question.
it doesn't change
All
for
right.
race. BMI is BMI, and these
Right.
numbers are based on what's going to increase your risk of chronic disease and what's going to decrease your risk. So we say if you're normal weight, that decreases the risk, and that weight for me is 148 pounds. Okay, no matter what I say or no matter what I do, if I'm over 100, really, if I'm over 145 pounds, that means that I'm overweight.
And for me, that's about 210 pounds.
Well, no, that's your definition.
No,
that's not the definition.
No, if I did my BMI chart and it said at 210 that I would be at 26. So, but what I'm saying is, I mean, I'm a big dude. So,
but that's not what the BMI calculator
I'm having a C-section this week to get rid of this 8.6 pound baby I'm having. But anyway, so
he made that number up. But go
no,
ahead.
I did not.
Yes, you did.
I did. You will check when we get off here.
Okay.
But anyway, you made me forget my question. I had a good question for you. So we talked about
BMI.
weight management. So no. So we deal with weight management at Me Bella Wellness Center, and it's really key for our patients because we deal with a lot of different symptoms that are sometimes related to the weight management that also deal with infertility. So well, how do we practice weight management, not weight loss? How do we practice weight management at Me Bella?
Okay, so you do a weight management consult, come in fast, and do the rest of metabolic rate test, so we know exactly what your metabolism is. I write you out an eating plan based on your personal metabolism. We also look at your body composition analysis, and we also look at some blood work. And then once we have all that information, we figure out a starter lifestyle plan that'll work for you based on the numbers that we have. And so we start working it, and then you go home and you try that for a couple of weeks. You eat your breakfast within the first hour, eat every 2 to 3 hours, count your calories, make sure you're getting plenty of protein in, make sure you're hydrating well with water. And then
we ain't gonna give away the plan though. Come get your consult.
Right. But you can, because everybody needs the coaching anyway.
But anyway,
I tell you all of it.
And this is where we coach weight management. It's weight management, not weight loss. Weight management, it's different. This is something you want to sustain throughout your life.
Right.
This
So
is not
creating
something
a real lifestyle.
I'm gonna lose for the summer.
Right. So
and then when the fall come back, I gain it back. No, we gonna lose and keep it off
because we're gonna create a plan and follow a plan that works for you, and that's gonna be some a
personal plan that works for me.
Right, a personal plan.
So my calories are not your calories,
and we focus on behavior modification and teaching behavior modification.
Okay.
So we have actual modules that you're gonna go through that hit on some of the key topics associated with difficulties with weight management. And then, we continue to play with it and monitor what you're eating and, figure out what really works for you, what works for your lifestyle, what works for your appetite, and what works for your body composition analysis.
Great. All right. So we talk about infertility, total wellness, and we talk about weight management, which is within total wellness. So now we're going to talk about the intimacy part, because all these tie together if you're trying to become fertile and have a baby, correct? So now we're talking about intimacy. So I know one of the things we see a lot is vaginal dryness, and that, how can that affect a woman besides the fact that it's not comfortable?
Right.
But how can that affect a woman, or what should they be doing to either deter that from happening, or is it just something that happens natural over time?
Right. And it is something that can happen naturally over time. So we would just treat the vaginal tissue topically at least twice a week, so that when you have intercourse, there's no discomfort there.
Okay.
Because we don't really want you, when you're trying to get pregnant, we really don't want you using a lot of lubricants, because that can slow down the sperm motility. So we really want you having unprotected intercourse without a lot of lubricants or anything.
And some lubricants have a anti
well, some of them do. Some of them do, but most of them don't. But
I'm just saying, if you don't know,
right,
you most definitely want to look at
and the goal again is to not have to use a lubricant. Right. So that's the vaginal dryness. We treat the tissue topically. We of course have some other procedures, like the O shot and the O wave, that definitely help. And the same for men. If you're trying for infertility or trying for fertility, since we're all doing things sometimes a little bit later in life, we have to make sure that you don't have erectile dissatisfaction, and we want to make sure that you can have, strong erections, and that you can finish so that you can plant the seed. You know what I mean? Right. So those things are going to all be important. So making sure your intimacy is up to play, not only with just making sure that you have the desire, but also making sure that it's not difficult and uncomfortable, and that you can proceed with physical intimacy without the issues that come along with aging.
Right. So infertility, total wellness, intimacy, weight management, and all that ties into being able to become fertile and then have a baby. So let me ask you, with not just the vaginal dryness, but just pain with intercourse, what is, I mean, I'm not going to say what can cause that, but what are some things people can be doing in their wellness to kind of prevent that long term, or is it something that you can even prevent?
Yeah, it's just complicated because so many different things cause it. So if you have fibroids, of course, controlling your fibroids with a diet of total wellness, you know, so that you're eating the right foods and maintaining a healthy weight. Everything goes back to total wellness.
And food, too.
And what you're putting in your body, and exercising too, you know, to help with blood flow for everybody. So what was your question?
I mean, I was just saying with the pain, not just the vaginal
dryness.
And
so pain with intercourse can be caused by so many different things. It can be just vaginal dryness, or it could be that you have fibroids, or that you have endometriosis. It could be so many other things. So that needs to be worked up, and then just taking care of the tissue and preventing the problems with total wellness and treating the vaginal tissue will definitely help you not have that issue if you're older and still trying to be intimate, whether you're trying to get pregnant or not.
Right. Right. Well, good. So we've talked about, again, fertility, infertility, total wellness, weight management, intimacy. She just touched on fibroids real clear. And if you haven't seen the webinars, there are some webinars out there where she talks a lot about fibroids,
endometriosis. So I do endometriosis on March 19th, where we'll talk a lot about pelvic pain, pain with intercourse, and all of those conversations. And we just had one on fibroids, contraception, abnormal bleeding, and menopause. So that was a really loaded topic, but it was great, well attended, and we got some great information out of that one. So make sure y'all tune in for the monthly master classes with Dr. Mia, and that's where we'll talk about usually a gynecology topic. This time it's endometriosis and improving intimacy throughout the different stages of life. So we're going to talk about endometriosis, but we also going to talk about some things that you can do to maintain healthy intimacy, because you know, at Bella, we want you to live well, age well, and experience everlasting intimacy.
Absolutely. So go ahead.
Well, I was going to ask you, Joseph, do you have a tip for the people?
Yeah, I think what's my tip? I thought about this, and it's the beginning of the year, and this is for the men, really. It's the beginning of the year. I don't know if how scheduled you are for your appointments, but make sure you're going to your doctor. It's the beginning of the year. Make sure you're going to the doctor. Things are happening to people unexplained. I don't know if they're going to the doctor or not, but make sure you're going to the doctor, and make sure you're telling your doctor everything.
And make sure you have a good doctor that
listening to you and really trying to help you accomplish whatever your goal is. If your goal is to lose weight, if your goal is just to be healthy, if you got high blood pressure, cholesterol, these are also things that affect your intimacy, because they also deal with your blood flow. So just be sure that you're going to the doctor. Be sure that you're explaining to your doctor everything that's going on. If you're having headaches, if you're having chest pains, if you're having numbness in your limbs or anything like that, make sure you're telling your doctor. Even if it comes and goes, make sure you're expressing that to your doctor, because during this day and time, food is not great for you unless you're paying for it and getting it organically. Liquor is not good for you. Alcohol is not good for you. Sugar is
definitely not good.
Sugar is like
cancer.
Almost. I'm not going to say that, but sugar is one of the culprits in a lot of illnesses that we deal with. And people are saying that if they cut out sugar, they start feeling better and losing weight too. So make sure you're going to the doctor. Tell them everything that's going on. Make sure you're communicating with your partner. Tell her or him everything that's going on, because, things are just happening and people are
Not going to the doctor.
Not going to the doctor.
They're not getting their screening.
Right.
So let's
and
say
if you
the
have
tip
your
for the
doctor scheduled, make sure you go to your appointment. Don't
Right.
do anything else but go to that appointment. But if you haven't scheduled that appointment, schedule the appointment.
Right. So schedule your appointments. Men, make sure you schedule your annual with your primary care doctor.
Mhm.
If you're over 50, make sure you're getting that cardiac workup. Make sure
Right.
your colonoscopy is up to date and that they're checking
Prostate.
on your prostate.
Right.
For
Absolutely.
women, make sure your mammogram is done if you're over 40.
Mhm.
Once a year, make sure you're getting your pap smear or annual once a year. If you have had a hysterectomy, you may not need a pap smear, but you still need that annual. And women, make sure you get your cardiac workup as well. Once you hit that menopausal stage, or if you have a family history of heart disease, start your workup a few years before that person actually developed or knew about their heart disease.
Mhm.
So get your screenings, because I'm finding that a lot of people since COVID have not gotten back into the routine of going to the doctor.
Right.
And as a result, we're seeing women with, higher stage breast cancer, or even cervical cancer, because we shouldn't even get cervical cancer in the United States of America if you're having your regular path.
Right.
So,
and another thing I've heard and seen is people who had COVID during the COVID time that had some side effects from COVID, they're not getting this stuff checked.
mm-hmm.
So if you've had COVID and you had some side effects
or
from COVID, a long term side effects,
mm-hmm.
you need to go get all of that checked.
Yeah, go to the doctor, y'all.
Go to the doctor.
And most of y'all even have insurance and you're just not going.
Right.
And like I tell my patients, insurance comes and goes, but at Bella, especially if you're already a patient, it's very affordable. If your insurance is not on when you're supposed to get things, we can make that happen for you.
We can absolutely.
So don't miss your appointments because your insurance is not in order, and prioritize your health and your screenings.
Yep.
It's Dr. Mia and Joseph. Thank y'all for joining. We'll see you on the 31st for this next one. And that's going to be with Arnett and Nikki Clue.
Yes.
And we're going to be talking about intimacy and how to maintain a healthy, intimate environment as well.
And for the record, we are celebrating 20 years this year. 20 years. So we're going to have a few couples on here who has been around for a while and get the opportunity to talk to them about what they've done to make this everlasting intimacy thing work for a long period of time. So again, thank y'all for joining.
We'll see you next time.
That's Dr. Mia. I'm Joseph.
Until next time, y'all have a great week. Bye.